Hello, this is Kathy Swanek. I am your current Director of Advocacy for the Florida Physical Therapy Association, bringing forward to you today a report on the advocacy efforts of the association throughout the year, as we are going to be meeting later on this month to discuss our strategic planning for the upcoming year. So in review, the advocacy pillar had a very busy year this year. First and foremost, we brought forward revisions to the PT Practice Act that have definitional changes that help to modernize definitions of physical therapist practice and provide inclusion of language for dry needling. Then we moved quickly into the pandemic of the COVID-19, working with stakeholders to help ensure that physical therapists will be able to deliver PT services through telehealth and also to be reimbursed for their services through telehealth. So starting with the Practice Act, we had House Bill 467 and Senate Bill 792. I want to send a huge thank you out to our bill sponsors, Cindy Stevenson on the House side and Senator Ben Albatrin on the Senate side. Representative Stevenson and Senator Albatrin fought hard for us, moving our bill through committee and ultimately successfully passing on both the House and Senate floor. So to go over some of the changes, first the definitional changes to the PT Practice Act. This revised Practice Act includes many important changes that will help affect physical therapy practice in the state of Florida. Previous definitions, as you know, were extremely outdated and did not reflect current practice. Some important terms that were added to the PT Practice Act include the inclusion of manual therapy, as well as updated language for both wound care and airway clearance for those that work in those areas of practice. Other changes made to the PT Practice Act include powers and duties of the Board of Physical Therapy Practice. And this does help provide our regulatory board with the authority to establish and modify minimum standards of practice for physical therapists, and that includes standards for dry needling. So dry needling has been a hot topic in the state for many years, and legislatively we have tried many different avenues to try and obtain the ability for physical therapists to perform dry needling in the state of Florida. The initial task force was created back in 2013 when I was actually serving as your president. Rob Stamborough helped guide that task force, and we've had many members throughout the state that have helped in the process as we've moved forward. He initially had a declaratory statement made. We have worked with our regulatory board who did determine that dry needling is certainly within our scope of practice. And we worked with the board to develop a rule a couple of years ago for dry needling. However, complaints were filed by the acupuncturists and the Oriental Medicine Group. And ultimately that ruling that the board made was overturned. The judge overturned the rule not because they felt that physical therapists were not qualified or that it was not within our scope, but that the regulatory board actually did not have the authority to make the rule. So this is an important change to our Practice Act. As physical therapist practice changes, our board can be more nimble in helping to develop rules for future areas of practice. The current statute became law on July 1st and does include language for physical therapists to perform dry needling. Our regulatory board is currently working on adopting rules. So you should refer to the statute at this point to determine whether or not you're qualified to perform dry needling in the state of Florida at this time. Moved into the legislature, heard early in committees and on the House and Senate floor. During this session, FPTA was time. There were ongoing meetings with all stakeholders in negotiations with those opposing, particularly the acupuncturists and the Oriental Medicine Group. However, we managed to come to compromises and had many meetings in Tallahassee, as well as different telephone conferences. And oftentimes, our current president, Jamie Dyson, and myself were up in Tallahassee, meeting with our lobby team, meeting with these stakeholders to come to a compromise. Early on, we did have the support of the FMA and the orthopedics and the chiropractors that had no opposition to our bill. So that certainly helped us to move forward. House Bill 467 passed unanimously with a vote of 119-0. Senate Bill 762 passed with a vote of 38-1 on March 10th, 2020, just in time for us to move into the COVID-19 crisis. So if we had been delayed even a couple of weeks, there was certainly a chance that neither of these bills would have been heard and passed. So by mid-March, Florida and the rest of the United States are reeling and are still reeling in a pandemic state. FPTA reacted quickly to establish physical therapy as an essential service and an essential to the healthcare system. Our previous work in establishing physical therapists as a provider under telehealth was crucial in helping establish reimbursement for PT services delivered through telehealth. We worked with Medicaid, Florida Blue, and other commercial payers to ensure that physical therapist services would be reimbursed when delivered through telehealth means. On the national scene, APTA reacted to work with CMS to obtain reimbursement for healthcare services provided under telehealth through Medicare. However, they initially neglected to include physical therapists as a provider of telehealth. So APTA members reacted quickly to a call to action from APTA, sending in letters to CMS, which did help establish PTs as providers of telehealth and to receive reimbursement under Medicare. Each year, the advocacy pillar works with our staff to provide state advocacy training. We sponsor this for our members to attend. We meet with legislators, we go through a training session. It's an important event to involve our membership in advocacy efforts and establish and maintain relationships with our legislators. Through these efforts over the past decade, FPTA has earned respect and recognition. There's better understanding of PT education and training and the importance of our role in the healthcare delivery system. And this is important to do on a yearly basis, as in any given year, due to term limits with our legislators in the state of Florida, as many as 30 to 40% of our new representatives could be in their first year of the job and have never heard of FPTA before. So ongoing education and communication with all of our representatives is crucial as we move forward with any legislative effort. Have to meet with our legislators. So past advocacy continues to be an important pillar of our strategic plan. Our professional association, FPTA on the state side and APTA nationally are the only organizations that are fighting on behalf of physical therapy profession and for the patients that we serve. Each year, APTA and FPTA set legislative priorities for the association, as we will do during our strategic planning meeting later on this month. Nationally, APTA PPAC, the Public Policy and Advocacy Committee, which is an appointed committee that I am currently serving on, presents an agenda to the APTA board for approval. And their current public policy goals include enacting policies that empower people to live a healthy and independent life, eliminating barriers to healthcare services, supporting efforts to increase efficiencies in the delivery of healthcare services that reduce administrative burdens to providers, as many of our outpatient therapists have to deal with, and help ensure transparency to our patients. Also looking to prioritize research and clinical innovation to increase access to the appropriate value-based healthcare services. And oftentimes the right provider is the physical therapist, and patients are not able to access us. Again, particularly for those patients with acute injury and acute pain, early access to physical therapists can help to reduce the need for costly surgeries or being prescribed addictive medications. As FPTA moves to revise our strategic planning goals for 2021, should we be focusing more outward as APTA has outlined in some of their public policies? I think FPTA can look to align ourselves with policies that are looking at population health, that help empower people to live healthy and independent lives, ensuring that they have access to health benefits for all Americans without arbitrary limits such as pre-existing conditions, helping to support programs that increase physical activity and exercise, looking at policies that help provide patient choice and access to improve patient outcomes by eliminating barriers to care. And one way that this is potentially a possibility to help ensure that patients have access to our services is to expand the definition of primary care services providers to include physical therapists, as one of the barriers to our care right now is the high copays because we are considered a specialist. Looking at value-based care and practice to improve patient outcomes by supporting efforts to increase efficiencies in the delivery of health services that reduce administrative burdens to providers. And again, looking at research and innovation and prioritizing research so that we can improve value-based healthcare services. Other legislative priorities that we are continuing to explore include having physical therapists being able to sign for disabled parking permits. This was a legislation that we attempted to move 2 years ago in 2019. However, it was not heard in committee. We were looking to possibly move that forward with another bill this year, but then pretty much the legislative session had to refocus on COVID and telehealth, and that took priority of our efforts. Certainly something we can readdress in the next legislative session. We're also continuing to work with our staff and legislators on Florida's inclusion in the PT Licensure Compact. As telehealth continues to grow, FPTA will continue to work with legislative staff, our lobby team, to explore the legislation to include Florida in the Licensure Compact. None of this can happen really without the support of all our members. So we thank all of you for continuing to be members of the association. And I would like to also encourage you all to be a member of the PT PAC. The Political Action Committee Fund helps us move forward with our legislative agendas. We don't have a tremendous amount of money in our PT PAC, and unfortunately, only a few of our members regularly contribute to the PT PAC. As we move forward into the next legislative session, it's really vitally important that every member contribute to the PT PAC. Whatever you can do, it can be $10 a month, it all adds up, and it doesn't have to be a huge amount. This year has certainly proven to us that we need the resources to act quickly and to be nimble in our ever-changing healthcare environment and legislative environment. In summary, please know that grassroots advocacy does work. Everything every member did, every PT, PTA student did to contact a legislator, to respond to those calls to action, sending emails, does work. It does count. It is noticed by our policymakers. Message to our better access to PT services for the patients that need us. Lastly, I'd like to give a huge thank you out to our FPTA staff and our incredible lobby team. Your dedication during the legislative session and throughout the year is so appreciated. We are certainly very blessed to have you on our team. If anybody has anything they would like us to consider during our strategic planning process, please feel free to email me at advocacydirector@fpta.org. Thank you very much. I look forward to hearing from you. Thanks to all our members for all you do. Thank you.